Dr. Geeta Nayyar is a leading physician-technologist, investor, and globally recognized chief medical officer who is redefining the dialogue around innovation, especially the role of AI grounded in humanity, clinical insight, and trust. She is known for bringing a vital blend of medical knowledge and empathy into high-tech environments and events, helping companies ensure that advances in AI truly serve doctors and patients while strengthening business outcomes.
So I think it was Spider-Man that said it best, right? With great power comes great responsibility. And the question, and in that spirit, the question we really need to be asking ourselves about AI and everything we really do in healthcare is not about our technology strategy, not what is our AI strategy, but in fact, what is our trust strategy, right? How are we winning the trust of our employees? How are we winning and gaining trust in institutions that deliver health and driving outcomes?
It's my pleasure to talk a little bit about Dr. G. Look, I've been in healthcare for well over 35 years. Rarely, if ever, in my career have I seen anybody take complex clinical strategy and translate it to understanding with an incredible degree of charisma that everybody gets value out of. What's been really cool to see is that with new emerging technologies such as AI, she's honed her skills there to provide incredible value to the audiences. I'd highly recommend her as a speaker, as a consultant, as actually any subject matter expert on any topic in healthcare.
Right? How many docs do we have in the room? How many nurses in the room? How many of you went to school to do prior auth? 0, right? So when we think about efficiency, when we think about simplicity, this is the biggest promise that technology has to offer us, but it really first starts with understanding our staff, understanding how to optimize their energy, and let's face it, we got the same mitochondria as everybody else in the room, right? From what Andrew told us. And what we have to understand is we have not normalized the fact that the workforce is the heartbeat of the hospital.
Doctors are expensive, they're burnt out, there's staff shortages, same with the nurses, right? It's the whole care team. Let's just replace those guys with some AI robots. How many people think that's a good idea or that's even happening in this lifetime? It's not. But the reason it's not is because of the consumer. Because the consumer's not going to make an appointment with Dr. G, the robot who has cool shoes. They like to see me with my cool shoes. They know the difference. The consumer is smart. They know the difference. They trust me, not a mini-me lookalike. Not with their healthcare. With their coffee? Sure. Right? So how do you keep the humanity in all this innovation? You cannot lose sight of it.
It seems like limitless potential to transform healthcare. So I'd love to hear from both of you on where you see AI, where you're using it within your own businesses, and where you see the future.
I mean, there's two types of companies in the world today, those who are great at AI and everybody else. And either you know how to use it to your advantage or you're in trouble.
I have worked very closely with Dr. G, and she is an absolute dream to partner with. She's a true expert in her field. She knows everything about misinformation and disinformation in healthcare, how AI is changing the way that clinicians work with patients, and how AI is changing the way that people experience healthcare and access information. She is knowledgeable, she's adaptable, and she's an absolute bright star.
But what's interesting when you look at all these trust numbers, and for the most part, and I know this is some of your work, people don't really trust institutions, right? People don't trust companies, but they do trust people, right? They do trust people. We have like that person we believe in or that inspires us or that celebrity or athlete, whatever it might be. Know your communities best. And what we have learned to date is that is incredibly valuable. And when you put the patient at the center, when you partner with your colleagues and do the right thing, it doesn't matter if you only have email and an analog phone call. You can save a baby's life. This is the most exciting time to be a healthcare leader. And it may not feel like that, right? Granted. But the people that were in your seats 10, 20 years ago, they did not have the access, the understanding of technology, AI. They did not have a consumer that was ready to meet them anywhere, anytime, in whatever outfit, in their living room, right? You guys are living at such an important crux in history and healthcare where everyone is hungry and thirsty to be healthier. You must not just be present for this moment, but you need to meet the moment. You need to meet the moment with everything you've got. We are all rooting for you, us on stage, your patients, your communities, and there's nowhere to go but up.
Thank you.